Today, I will discuss the organ shortage crisis. According to Penn Medicine 2022, 95% of U.S. adults support organ donation, but only 54% are registered donors. When you receive your Florida driver's license, they ask you whether or not you want to become an organ donor. My goal is to convince you to become an organ donor. There is an overwhelming need for organs. Changing the U.S. system and educating the public will solve this problem. An increase in living donations will benefit patients. The U.S. is suffering from an organ donation shortage crisis. The U.S. model is flawed. The U.S. uses an altruistic model, meaning that Americans in need of organs rely on the generosity of donors. In AMA Journal of Ethics in 2014, Richard Weinmeier proclaims the altruistic model for organ donation has proven insufficient in developing a supply of organs that can be effectively used. There are not enough organ donors to meet demand. The VCU Health website shares a story about Dylan Chris, who donated a kidney to her husband, but won't get a donor card. She says, it's an unspoken thing in the black community. A lot of people shun away from being on the donor list because we're afraid. I will not sign it because we feel like we're deprived of quality health care. Like if the doctor knows that I'm on the donor list, they won't do everything in their power to keep me alive. This concern originates from generations of mistreatment by the medical establishment towards African Americans. The fact that a large group of citizens don't trust the organ donation system proves the U.S. model is flawed. Racial and ethnic populations are more likely to need a transplant, and evidence shows they are unlikely to donate organs. The shortage is perpetuated by the low rate of organ donation by minority groups. In AMA Journal of Ethics in 2014, Richard Weinmeier proposes that distrust of the medical system contributes to low donation rate. This is proven by people like Dylan Chris being afraid to put her name on a donor card. The VCU Health website states distrust by the black community is linked to the overwhelming need for organ transplants. Compounded with the fact that minorities are less likely to donate organs, they are more likely to need organ transplants. According to the National Kidney Foundation website, African Americans are more than 3 times more likely than white Americans to suffer kidney failure. Kidney disease can become chronic, upon which transplant is needed. This explains why minorities represent a majority of patients on the waiting list. What are some solutions to this problem? Maybe a change of the organ allocation system. While ambitious, the United States may benefit from changing its current opt-in system to an opt-out system where everyone is a donor unless you actively opt out. The Atlantic 2014, Tiffany Wen says, in a recent study, researchers concluded that Spain, with an opt-out style of consent, had the highest rate of organ donation of the countries studied and represents a successful model to emulate. Making the U.S. system more similar to the ideal Spanish model will increase the organ donation rate. Another country the U.S. could emulate is Israel. The Atlantic 2014 states they have a law that gives prioritization to patients with a history of donation. This incentivizes the population to register as donors. The statistics prove the law worked, as the annual organ donation rate from deceased donors increased from 7.8 million to 11.4 million from 2010 to 2011. 35% of organ recipients who are part of the prioritization system. As currently constructed, the U.S. model relies on the generosity of donors. Enacting a similar law to Israel will incentivize people to donate, thereby increasing donor registrations. Educating people will increase donors. Altruism, or the concern for others' well-being, remains the prime motivation for organ donation in the United States. However, despite education efforts appealing to altruism, organ donation has not kept up with the need for organs. In the International Journal of Environmental Research and Public Health in 2022, Karen Doppelt states, raising awareness and positive attitudes towards organ donation among the wider public is necessary. Consequently, it is essential that information is accessible. This notes the importance of educating, but also advertising organ donation. The goal should be to spread positive attitudes, as those will ultimately be translated into donations. From the VCU Health website, Dr. Dhiren Kumar says you can help educate many others in your community who could possibly be a donor. Answering common concerns about donating an organ and educating people on the finances will settle fears blocking people from donating. For example, telling people that the average survival rate of a kidney donor is 95% will be persuasive. Kumar also says the lack of awareness in minority populations about the dire need for organ donors and the safety of living donations contributes to the low level of organ donations in those communities. The Human Lead Transplant Center tasked a coordinator to engage in minority communities regarding kidney transplants. Following this, they saw an above-average number of minorities receive transplants. Becoming a registered organ donor will positively affect people's lives in the future. Your guarantee of organ donation will help more than 100,000 people awaiting life-saving organ transplants. The VCU Health website names advantages that living donations have over deceased donations. Additional organs are available, the waiting list shortens, and recipients gain a superior transplant outcome. When more people complete living donations, these advantages will become more common and ultimately have a positive effect on the recipients. As technology and medicine advances, organ donors will be able to save more lives. Mayo Clinic, 2022, says, among the major advances is perfusion technology, which allows more time between organ retrieval and transplant. Antiviral drugs can also be used to eliminate disease from people accepting an organ from an infected donor. Organ donation will help disadvantaged people. According to Penn Medicine 2022, 80% of patients on the waiting list are waiting for a kidney. The average waiting time for a kidney is 3 to 5 years. The more time passes, the sicker patients become while on the waiting list. Living patients can help these patients during years of dialysis and years from the waiting list. The VCU Health website mentions that 60% of the 106,000 people on the transplant waiting list are ethnic minorities, meaning that minorities represent a majority of patients on the waiting list. This is due to genetic predisposition, limited access to healthcare, and prevalence of diabetes. Race does not impact organ donation. Instead, they're masked based on blood type, body size, time on the wait list, and more. Nevertheless, a diverse donor pool makes it easier to match organs with transplant candidates. To summarize, the organ shortage is a crisis. The organ donation system is non-optimal. Minorities are more likely to need a transplant and unlikely to donate organs. Overhauling the U.S. donation system and educating people will solve the problem. An increase in living donations will benefit patients, and you help disadvantaged people when you donate. You should become more knowledgeable of the U.S. donation system. I would like for you to become an organ donor. Begin by registering with the state donor database at Donor Life, Florida. I would appreciate if you took some time to consider a living donation. Make sure that on your driver's license, it says donor.